Not a very good mom.
Not
very attentive.
Not attentive, right?
Yeah.
So focusing on Mrs. Morgan.
I forget the names. Yeah.
What, other than her being emotionally distant, not putting words in your mouth, what else did you notice?
I mean, the fact that she's told about this tape that is supposedly kills you in 7 days. And meanwhile, her son was able to access this tape and put it in, and she just was like, "Oh, well, I didn't notice."
Okay, you're not talking about Samara's mom. Okay, you're talking about.
Oh no, sorry. I always forget the names.
No worries.
Like all the characters.
Okay, so yeah.
Oh, Samara's mom is bad too, though.
Yeah.
There's something to talk about Samara's mom as well. That's why I thought you went. Okay, so if you're looking at the main character, you think that there's some emotional distance there with regard to maybe allowing her son, who's young, to watch this tape.
And doesn't he call her by her name, her first name?
Yeah, that's odd.
Yeah, that is odd.
Super weird.
Yeah, so I think we see someone who's precocious. And of course, we always have to ask the question, why? So that's a concern. Yeah. And she happens to be I think she's the aunt, right? Her niece is the opening scene. So. The niece and her friend. And because she's an investigative reporter, she works for a magazine or newspaper. She has certainly a curiosity and interest about what happened to her niece. Anything else? By the way, just very brief tangent. With regard to her niece, if her niece had survived, or no, actually, if her niece had not survived, and again, I'm blanking her name now too.
I forgot.
The aunt comes by and tells you. Rachel, yes, Rachel.
Oh yeah.
Rachel tells you what happened. What are some of the thoughts you have in terms of the cause of death? What do we know?
Sorry, Rachel's supposed to. If the niece survives.
No, the niece unfortunately does not survive. Everything is perfect with regard to how it works out in the movie.
Okay.
And that's all communicated to you by Rachel, who comes in and says, hey, by the way, my niece passed away. This is what happened. As a clinician, what are your thoughts?
Something wrong.
Deeply.
She's having hallucinations.
So hallucinations, that's I think part of the picture. What else?
Seems to be some confusion.
Some confusion, which way?
In terms of because when they're watching the video and when they're doing these things, it seems like they themselves don't actually know what's going on too. Like they're also confused by the entire aspect of the film and what it means. You know what I mean? Because there's flashing pictures. They don't know what it really means either. All they know is that, okay, this is going to kill us, basically.
Mm-hmm. Okay, I want to get back to that thought. That's a good pickup.
Do you view these nightmares that she's having as flashbacks from a traumatic event, PTSD?
Could be. You have to see if this is a nightmare versus a flashback, if the individual is experiencing these images while REM sleep or not, right? That's certainly, one would be in REM, the other one would be more in the beta or alpha state, which is what we are in right now, awake and alert. Alert being beta, less alert being alpha, right? Anything else? What was the cause of death? We heard it. It's in the script.
Unclear death, or her heart just stopped.
Yeah. So a young girl whose heart just stops, who was hallucinating.
Drug.
Which one?
Cocaine.
Coke. Yeah. Yeah. This is a fairly straightforward case on a shelf exam of cocaine. Any young person who suffers a heart attack, survives or not, is cocaine intoxication until proven otherwise on a psychiatry or any really medical school shelf exam, period. Now, is there any evidence of nosebleed?
Yes.
Where? When?
I think after the second day of Rachel, she starts having nosebleed, and the son has a nosebleed next to
Which means that it would be reasonable to assume that if we saw her niece prior to day 7, she also would have had a nosebleed. No, by the way, that happens to be another clinical finding that always presents on shelf exams. That is, when there's a heart attack, and now we could even say in someone who is middle-aged, And there's evidence of nasal septal erosion, right? Intranasal use of cocaine. It's cocaine use as the etiology of the heart attack now, even when someone is middle-aged, right? So that's another piece of evidence that I think suggests that Rachel's niece suffered an acute MI. Her heart, quote-unquote, just stopped, secondary to cocaine use. Nosebleed, young person, hallucinations, triad, it's going to be cocaine intoxication or cocaine-induced acute myocardial infarction.
I have a question. Are there other stimulants that can result in heart attack, like
All of them
alcohol or okay?
Now, cocaine, because of its intranasal use,
Yeah.
and even crack, when you smoke it, has the most rapid onset of action,
Yeah.
which means that it has the greatest adrenergic surge, so it poses the most risk. But the answer is yes.
Okay.
Okay. Now, the others, amphetamines, etc., are not intranasal, so you're not going to get the nosebleed.
Yeah.
Right. So hers was coke. She was snorting cocaine.
Even in the movie, during the funeral, one of the characters is like, you don't see a teenage girl getting a stroke unless she's on drugs.
Yeah, I think you're right about that. Yeah.
Right? Clinically accurate. Right. Somebody spoke to a psychiatrist prior to writing that script. Fortunately, it wasn't me.
Also, her mom was like, "Oh, I went to 3 doctors, and none of them can tell me what's wrong with my daughter." Okay.
Yep.
And
So that's a statement about the current level of medical care, right? The current state of medical practice in the U.S. When you go to multiple physicians, because a lot of physicians find it very difficult to address aspects of substance use. And fortunately, relatively speaking, psychiatry, because of our training, is least susceptible to that. But certainly mistakes are made there, sir. No doubt. All right, so I think that's more of a social statement that was added into the script, and one that is not completely inaccurate. Final thoughts about Rachel's niece's death?
I think that what's interesting that now that you're saying like cocaine use, and we were talking about how the mother is kind of like not entirely like, you know, there. The nosebleed happens with the son, and we know that the mother is also really close to the niece, leads me to assume that either one of them could have gotten the coke from that house. Like, maybe not the mother giving it to them, but like it just being somewhere, and yeah.
Yeah, it could be. I mean, so you're thinking that her son might actually have found it as well?
Yeah, because due to his nosebleed as well.
You know, and there's a comment made that he's struggling because he's very close to his cousin.
Mm-hmm.
Close enough where he felt comfortable going into her belongings and stealing some.
Yep.
Or watching his older cousin, who's obviously, which would lead to a very impressionable kid.
Mm-hmm.
Could be. So, certainly could be.
also in the beginning of the movie, I forgot their names, of course. She was like, her friend was like, "Oh, where does your mom keep the Vicodin in your house?" Like, that's a joke. So,
Yeah. Maybe it wasn't such a joke.
well, you know what I mean.
Right? Why in the world would she ask that? Other than the obvious, which is they want to experiment. And oh, by the way, your comment on the way they treat this tape is, I think, a metaphor of experimentation. Right? I mean, they're going after this tape, they're watching this tape, you think it might be inappropriate. Why do this? Because they're experimenting. It's exciting.
Thrill seeking.
Right? So nice parallel, albeit metaphorical, with drug use in general.
Scale likely.
Why would they ask about Percocet?
Like,
Vicodin. Excuse me, Vicodin. Why ask about an opioid?
for fun.
For fun?
If they're addicted,
Huh?
they're addicted. already?
Potentially. But it's in the setting of what they actually did.
You can bring them down after.
Exactly right. Very commonly abused to bring one down from the cocaine high.
Mm-hmm.
Right? It's called speedballing.
Yep.
Right? That's how John Belushi died. You don't know who he is, but look him up. He was real. Right?
My first thought was, oh, they're probably drinking too.
Huh?
That was my first thought.
Again, that would not be surprising. But certainly, opioids are commonly used in conjunction with amphetamines, notably coke, to take the edge off and bring one down from a sustained high, right? It acts as has a tranquilizing effect, CNS depressant, and therefore it's often used in combination. Would I surprise you if that drug combination, in addition to Speedball, was also named Ring? It isn't. But I like the reaction.
I was like, wait, really? I haven't heard about
There's
that.
nothing stopping you from getting an Urban Dictionary tonight. making that a reality.
I'm gonna start making it a thing.
We need a Galfan research group for Urban Dictionary.
Yeah.
We might be put on probation, but it's a consideration. All right. So I think let's complete this with regard to what you're going to be looking forward to. I'm sorry, in about a week. Cocaine intoxication looks similar to a panic attack. All right. So if you think somebody has a panic attack, and that of course could include myocardial ischemia and an overt acute MI, that's cocaine intoxication. So cocaine induces panic. Cocaine induces an MI. And the only difference on a psych shelf between the two is that for the MI, you have evidence of myocardial ischemia. The same signs and symptoms absent that equals a panic attack, which of course is always substance-induced until proven otherwise. So that's acute cocaine or stimulant intoxication. Stimulant withdrawal, depressive episode. If somebody came to you who is withdrawing from a stimulant, is on a cocaine crash, and somebody came in with a major depressive episode, in a slice of time, they are clinically indistinguishable, period. The only thing that I've seen on exams that might help you think of one versus the other is that the sleep problem in cocaine withdrawal can include vivid dreams, whereas that is very atypical for a major depressive episode. Opioids. Opioid intoxication, pinpoint pupils. Okay. Opioid intoxication, change in mental status, difficulty with attention, slurred speech. Right? That's opioid intoxication or even overdose. Opioid withdrawal, TGI Fridays. Right? You need 3 of the following. Right? T stands for 3. GI symptoms. F, fever. Rhinorrhea, runny nose. Insomnia. Dysphoria, arthralgias, yawning, and then sympathetic symptoms like sweating. Right? TGI Fridays. Only need 3 of those. Right? We may have, if we see a bit of this prequel, we may actually see evidence of either with regard to their use of coke and the Vicodin. Final thoughts. Very minor character. I have no clue how many seconds she's alive in this movie. That is, how long is that opening scene? But again, I think it opens up for, a fairly good discussion with regard to what happened. And then a review of both cocaine intoxication and withdrawal, as well as that of opioids. Another character. Yes, let's get to the low-hanging fruit. Samara Morgan. So is she adopted?
Yes.
She's adopted. Any evidence to suggest that she's not adopted? And maybe that was a red herring.
Well, they said that they went on a trip and they came back with her.
Do you want to?
They said they went on a trip and they came back with her.
Okay. That's what they said. Any evidence to suggest that might not be totally accurate?
It said a couple of times when someone else was in the hospital, the mother, that she conceived and lost a child. So it's possible that she had conceived.
Yeah. Now, I don't know why a mother would actually have a beautiful baby daughter, name her Samara, and then come out with a story of I lost a child and adopted her. So that's a little unclear. However, there might be something to this. If what? What might be a topic to discuss now pertaining to Mrs. Morgan?
Like malingering or something.
Could be malingering.
Seeking attention.
Postpartum psychosis?
Yeah. Yeah, postpartum depression, postpartum psychosis. Right? So postpartum depression should be differentiated from the postpartum blues. Postpartum blues happens almost immediately. Matter of fact, 50% of depressive symptoms occur during the pregnancy for both blues and depression. Hence, the name change from postpartum to peripartum. Right? The blues are transient, while postpartum depression is not. Postpartum or peripartum depression actually fits all clinical criteria for a major depressive episode. So not only is there dysphoria, but there are related signs, 5 total, that last at least 2 weeks. Hence, peripartum depression, while it may start during the pregnancy, will last at least 2 weeks upon delivery, or incident to delivery. On the other hand, we have another condition called postpartum. Here we actually say postpartum psychosis. And it looks as if there might be 2 subtypes of this condition. One is an untreated peripartum depression, which due to either mismanagement or going untreated, continues, becomes more severe, and we know that it, in its severest form, can incorporate psychotic symptoms, such as the delusion that your baby actually miscarried and you adopted another. On the other hand, there is another subset that does not arise from depression, but just is a onset of psychosis. And in that case, it usually occurs as the onset within 4 weeks of delivery and looks to have some relationship to a latent or occult bipolar illness. So my question is there any evidence in Mrs. Morgan of her having had bipolar disorder, either provided you in this or a prequel? So I'm guessing the radio silence means no. It's not relevant. It's not obvious to us, right? But it's something to consider here, right? And if they were to make a prequel, I think if they consulted with our group, we would ask that there be some kind of a hint or allusion to a previous manic episode in Mrs. Morgan that would establish a bipolar 1 illness, therefore allowing for a further discussion of what ails Mrs. Morgan and why does she think that she miscarried and adopted. That is, that delusion would be in the context of a bipolar or related disorder. Right? So very quick review: postpartum blues, peripartum depression, postpartum psychosis. Right. Anything else for Mrs. Morgan? Of course, if she truly did adopt Samara, we could just talk in a more straightforward case about major depressive disorder, even major depressive disorder with psychotic features that did not have its onset at or around the time of pregnancy, right? The pregnancy would have little to do with it.
So if the horse's down was from some type of illness, like I was thinking like spongiform, something, encephalopathy, and she was infected with that.
So it may be an infective agent provided as a hint through what happened to those horses. Sure, yeah. Any other evidence or any other role these horses play? So horses in literature and in Hollywood often provide us information that we don't currently see on the screen. That is, they're intuitive, and they will often act or react to something that is yet manifest for us as humans, whether it's the character in the movie or us identifying with the character. And this has some relation to horses being used in equine assisted therapy, or EAT, right? Horses are prey animals, meaning that their hearts, being 5 times the size of a human, have an electromagnetic pulse that allows it to sync with people around them. So if you were to approach a horse and say, oh, it's okay, everything's fine, but have your heart rate at 130, they're going to withdraw. Right? They usually don't understand the human language. They're going to react to your heart. Right? On the other hand, if you approach a horse and curse it out, I don't know why you would do that, but curse it out with a sustained heart rate of 80 and regular, they're going to allow you to do anything you want to it.
Even if your voice is like aggressive?
What's that?
Even if your tone is aggressive? I feel like you would have to have
No, there's a mismatch.
a flat cursing
yeah.
now.
Yeah. Yeah. And we actually, before COVID, ran a medical student elective where you were taught bedside manners on a horse farm. Because very often we're at bedside with patients telling them that their labs look good, but non-verbally we're communicating that there's a problem because of the way we're standing, because of the way we're talking. And we teach medical students the correct way to express that non-verbal language. Through the use of horses, they bring it back at bedside, and therefore what they're doing is consistent with what they're saying. Right? So it's a creative way to learn bedside manners. We see this in the ring. Now again, I think that most of the US audience, the world audience that watches the ring, watches that horse jump off that ferry as an omen. And it's not exactly wrong. But what that horse is picking up on is that there's something in terms of humans that are around them that have something going on with them. That's the reaction. Right? So I can say this out loud. It sounds kind of dumb when I say it, but I may as well say it out loud. When horses communicate, they communicate non-verbally. Right? I mean, I guess there's a couple of exceptions to the rule, but for the most part, they communicate non-verbally, which means that you must communicate non-verbally to them. And that's usually through your heart rate, due to they're having what is referred to as a coherent heart rate. Right? If you're ever asked, not on a shelf exam, but again, pretty cool pub speak, the name of that electromagnetic pulse is called a torus.
A torus?
Torus.
Oh, you said Taurus.
Yeah, me too. And I was like,
Sorry.
oh.
Oh, the sign.
It's called a ring. All right, so yeah, I think there's a major role here with the horse. Again, something as simple as an omen and a harbinger, but something perhaps a little bit more complex. I think it's the Health Science Institute has a lot of published data on equine-assisted therapy. Any other thoughts here about Samara?
The Reddit theory, again, bringing that up that Amy had texted about. I think in there she was talking about how both, going back to Jake from is that his name, Jake?
Yeah.
From Thinking of Ending Things, they both seem to have like this despairing loneliness, and in Samara's case, she wants people to experience that in those like 7 days. That's what the theory, I guess, was saying. Because of everything she experienced, she's kind of like projecting that onto other people and want them to experience it in such a context that it has to be like 7 days long because of how like deeply ingrained it was for her.
Yeah, the clinical term for what you described for Samara is analytic depression. And it's depression, usually in a newborn, and a failure to thrive due to failure to achieve a maternal bond. And that would make sense if Mrs. Morgan was depressed, right? So postpartum depression is an independent risk factor for analytic depression in an infant. And if left untreated, failure to thrive, that infant, of course, can progress to major depressive disorder in a toddler, which is usually unheard of, but can occur.
Yeah.
Right? Which again may explain what we're seeing here.
I think it's possible that there's sometimes she might have like conduct disorder. I mean, if we're thinking of the way the horse has died, is that like she had some part to play in it?
Yeah, so conduct disorder is the forerunner. It's the psychological predisposer to the condition known as antisocial personality disorder. So individuals with conduct often demonstrate cruelty to animals, destruction of property, and then oppositional defiance to authority figures. That's usually the triad when you think of when you discuss conduct disorder. Clearly there's something going on here. However, that disorder, especially in children, is often a reaction to something. And whether it's the distant parenting due to postpartum depression, whether it's something else, that will be part of the family therapy. I mean, it's impossible to treat a child for any behavioral disturbance, much less a mental illness, without engaging the entire family unit. And unfortunately, Mrs. Morgan commits suicide, Mr. Morgan commits suicide, so the family unit has psychiatric issues that really should have been addressed. I don't think as a clinician, we would actually take verbatim that both committed suicide, quote unquote, because of their daughter being pure evil. That wouldn't fly in an ambulatory care practice. Right? What else about Samara? Analytic depression, aspects of conduct, cruelty to animals, the mass migration / slaughter of the horses.
They say she never sleeps.
Yeah, that was the other one. Right, she never sleeps. So, it starts out with the idea of insomnia, right? I think that's again, the low-hanging fruit. Now, this allows us to talk about how to address insomnia in ambulatory care practice, which certainly could appear on your exam. If someone comes in, and insomnia is a very common chief complaint in outpatient practice, the first thing that I believe a clinician should investigate and consider is that the complaints of insomnia are in the context of a larger mental disorder. So instantly, if that were the case, which mental disorder would you now pivot to, and which questions would you now ask?
Mania.
Mania? Any others?
Dig fast.
Dig fast, good.
It could also just be like bad sleep hygiene, so caffeine use later in the day.
We're going to get there. Mm-hmm.
Other causes of insomnia.
So you said the bipolar-related disorders, and is there another group of disorders that you think might also be in the hierarchy?
Depression.
Yeah. I think starting with what we would generally refer to as the mood disorders, specifically the bipolar and related disorders, dig fast, as well as the depressive disorder, city caps, is a great place to start. Now, inherent to that interview, in either case, whether you go direction of bipolar versus the direction of depressive, inherent is that the clinician would also need to investigate two things before evaluating for the mental illness itself. Which two things would you consider here? That you must consider to be the etiology of either the depressive illness.
Substance or the medical issue.
Exactly right. So even though I said that the first step in an ambulatory care practice assessment of insomnia is to consider it in the context of a larger mental disorder, when you choose the top two mental disorders to consider, both require you to investigate the direct physiologic effect of a substance as well as another medical condition. So that's implicit, right? So, and I think that's a great place to start. Now let's say, for our discussion purposes, none of the above. Well, now you can expand your differential to include probably anxiety disorders. That's, I think, your next highest field. If at the end of the evaluation, you find that the individual's complaint of insomnia is not due to another mental disorder, and that also means not due to a substance or a medical condition, right? Because that's a 3-in-1 now. Now you're looking at this being a primary sleep disorder, right? And now you're kind of relocated to the sleep-wake disorders chapter of the DSM. That chapter is in two parts. One part called the dysomnias. That's a dysregulation of sleep and or its architecture. And the other section is called the parasomnias, right? Behaviors at or around the time of sleep. Right? Insomnia is a dysomnia. Right? And this might be something now referred to as insomnia disorder. It's a problem with the dysregulation of sleep. What other dysomnias should you consider in evaluating Samara at this point in her care?
Rather than that, she doesn't think that there's an alteration in when she sleeps, like delayed sleep phase cycle.
So circadian rhythm sleep disorder, right? The delayed phase. There are subsets to that too, but there could be something wrong with Samara's circadian rhythm. Does not appear to be what's going on here. Anything else? Hypersomnia is another one. Right? I think that's intuitive. I think most of you thought of hypersomnia perhaps being a variant of insomnia disorder, but the DSM made it its own distinct illness, hypersomnia disorder. Others are obstructive sleep apnea. where people stop breathing during sleeping. It does not appear to be what's going on here. Narcolepsy, where REM intrudes other stages of sleep and perhaps even normal wakefulness. Probably not what's going on here either. Right? So those are other considerations for dysomnia. Bottom line is that we have to get Samara to a sleep study. We have to get her to a polysomnography for some kind of direction as to what's going on with her sleep architecture. But I think initially, if not due to another mental disorder, this may be an insomnia disorder. She simply doesn't sleep. She never sleeps.
And that can induce like psychosis.
Yeah, that's going to be a risk factor for developing then mental illness. Okay. Any other characters in The Ring?
Oh, the dad, like the strange dad, I guess.
The strange.
Is it strange or estranged?
Estranged.
I thought you said the strange dad. I was like, I guess he was
Hey,
strange.
both might fit.
Estranged.
His name is Noah.
His name's
No.
Noah.
Hmm? What's your concerns of Noah?
He's just unnecessary.
Oh my
I just
god.
don't like him. Sorry.
Like I guess
He doesn't try.
he has like a weird relationship with his son, and his son almost sees him as like the way he talks to him is almost like he's talking to someone his age or younger or something. It's kind of weird. Like, I mean, he is pretty precocious with his mom too, but just the way, I think they had a conversation where he was like, oh, your mom and I were very young, and he's like, yeah, I know, she told me already, or
Yeah, something.
that
Yeah, I know what you're
weird
about.
dialogue.
Yeah.
And what's the current relationship with Noah and Rachel?
Weird as well.
Yeah, not
Yeah.
defined, which would probably make a child really like confused. Yeah.
Yeah.
They were like, oh, we went through a traumatic event together. Let's love each other again. I don't think that's gonna work out.
I also think it was like probably one of the first times they were together, and Rachel was leaving, and she was like, "Oh, well, this always ends like this with us arguing, so let's just like end it here," or whatever she says. And I feel like that's such a bad relationship for a kid to be viewing like that happens so often. Like, just wasn't.
Yeah, I agree with you. I think the major teaching point that Noah provides is further support of what ails his son. Again, there's significant family discord for this little boy. Not only a distant mother, Rachel, that he calls by her first name, but now I think evidence that the family dynamic is even more complicated, given Rachel's relationship with Noah. I really do feel that's Noah's main role here. Any final thoughts about The Ring? I will add this. In using The Ring to review aspects of sleep medicine, the other category of sleep disorder that is other than the dysomnias or the parasomnias. So if there's anything to review, it's those abnormal behaviors that occur at or around the time of sleep. Things like REM sleep-wake disorder, sleepwalking disorder, night terror disorder, nightmare disorder, things to consider. Final comments?
I thought it was interesting, like the interview, like I think it was the doctor and then Samara was there, and she was saying how like, oh, like I just want it to stop, like I'm sorry that I feel this way, but like I do want it to stop. And now that you're saying about like the insomnia, it makes sense that like she couldn't really turn it off, and that could probably cause her to ruminate on stuff like that.
I think she was talking about her desire to hurt people.
Yeah.
They're like, do you want to hurt people? She was like, I do,
She was like, I wish it would stop,
but it won't.
but it won't.
Yeah, so that's interesting because, I mean, young kids, and again, out of the mouth of babes, have those impulses because we all have those impulses. That's part of the id. But very rarely do they come to conscious awareness because of an intact superego. Now, in this child, like in most children, the superego is going to be underdeveloped. So it is not uncommon for a child to actually entertain these impulses. I mean, that was really the core understanding of the Oedipal complex, right? A child's desire to kill their same-sex parent, right? So this may be a replay of the Oedipal complex, because even though Samara is a young girl, and it would be really referred to as the Electra complex, it's the same thing. Samara wants to kill her mother to possess her father, and by the way, her mother does die. So we think it's a suicide, but this may be a case of matricide, and therefore a Hollywood version of the Electra complex.
And it's interesting that you say that, because that would almost then lend itself to like Aiden calling his mom by her first name. It's almost like a different
Like a
relationship, and treating the boyfriend as if he's like almost not competitor, but like almost like, oh, you're getting all my mom's attention, like that. So it like.
And like the moment you said where he's like, oh, I already know that. Like she already told me that. Like kind of thing. Yeah.
All right, we'll end it there. Okay, so that'll be our discussion with regard to the Night Watch film, The Ring. We'll post on Twitter. I think next Friday, actually, we're off. You guys, good luck on your exam. I think we're off next Friday, but we'll be posting on Twitter with regard to our next set of movies.